Without Nigeria accelerating, we cannot reach those targets which everybody agreed that we have to reach within the universal health coverage and health security agenda in the world. So that's why I'm extremely privileged, but also I feel a lot of responsibility to lead this team during this transformational time.
Hello, Dr. Pavel. You are welcome to our studio. Thank you for joining us on our Curated Conversations series. It is a monthly video program that we do, talking to global thought leaders like you, and just getting an insight into how we can strengthen health systems like you're in the business of doing. Dr. Ursu Pavel is the country director for WHO in Nigeria. So it's an absolute pleasure to have you joining us in the office today. I'm going to start by just reflecting on, your last journey as you joined us here, leading the largest African country office, if I'm correct.
Yes, that's right.
All right. Your previous post was Turkey.
No, he was in Geneva, headquarter.
All right. Please tell us how that has been, your journey, just at the WHO.
Thank you. Thank you for having me, and good afternoon. It's a pleasure to be here in your studio. My journey started in Eastern Europe first. So I worked with WHO in that region. Then I moved to country operations in Central Asia. So I've been there for 5 years. Then I moved from there to Turkey for 5 years. And after Turkey, I moved to headquarters, where I led the Department of Delivery for Impact. And after 5 years, we see 5 years all the time, I decided to come back to the operations, and I've been really looking for opportunity to work in a more complex environment, to where we as WHO can show strong support for an accelerated measurable impact. And obviously, what I learned along the journey, how important is really to contribute with strengths from the organizational perspective and support national systems in delivering measurable results. So it's been an exciting journey. And that exciting journey brought me to the most intensive operations that WHO has, in fact, not only in Africa, not only in the African region, but globally. So I will have the opportunity to unpack that during the interview, and I'm extremely excited. Also, it's a privilege, but it's also a responsibility to be during that transformational time here in Nigeria, because by all means, when you look at the potential regional impact or global impact, without Nigeria accelerating, we cannot reach those targets which everybody agreed that we have to reach within the universal health coverage and health security agenda in the world. So that's why I'm extremely privileged, but also I feel a lot of responsibility to lead this team during this transformational time.
Interesting, Dr. Pavel, and thank you for really putting that in context for me, because it's a pivotal time for us here in the country. We are piloting, or in the middle of, really piloting some initiatives that are supposed to get us closer towards achieving universal healthcare coverage. And I understand the role that primary healthcare plays. It's central, front and central. It is the backbone for actually building resilient health systems. Yet, translating that idea into sustained, equitable services at community level remains a challenge in many settings. And I'd like to just understand from WHO's perspective what needs to change practically for primary healthcare in Nigeria to move from policy to lived reality, especially for those in the underserved areas.
This is an excellent question. How we move from vision, policy, frameworks to something very concrete, that what people need to get in terms of the services, and particularly those who are most vulnerable. And from that perspective, looking at the reality on the ground in Nigeria, there is no lack of vision. There is no lack of planning or wisdom or capacity, even in terms of the knowledge around primary health care. But what we face a very concrete context where the primary health care is under-resourced. There is a lot of fragmentation still, and where is still in that transformational timing the evolving, I would say, clarity in terms of the accountability across levels. So what has to happen, in my view, responding to your question, is like putting together the puzzle, because we are talking about policies, we are talking about people, we are talking about resources, financial resources, but also human resources. We're talking about data, and all those elements, foundational elements, have to serve a very purpose of delivering services to people. So I think what has to happen is basically aligning, making sure that the system is defragmented and is clearly accountable for very concrete services at each level. And the most important in that equation is basically doing so through a transition with responsibilities around the very last mile of when services are happening, so that people can understand, can trust the system, can trust at the community level the primary healthcare services, and that those services could be provided timely and with the proper quality, and making sure that the funding flows and expenditures also attract to enable that. Obviously, when we are facing limited resources, limited human resources, then it's not about the buildings, even though we need more infrastructure. But I think it's even the available infrastructure has to interplay properly with data, with human resources, with funding streams, so that this would enable the proper services to the people.
Interesting. You mentioned some very key terms right there that just, resonated with what really, needs to happen for some of the communities that we have worked in, and the feedback that we have gotten. The issue of trust, the issue of quality of care, and then, more about that than the infrastructure itself, but of course, improvement in infrastructure and funding, of course, is essential to get that whole continuum of services going. And we're in an interesting time right now with the shrinking official development assistance, and yeah, a number of people are feeling a little bit of the pressure, and of course, the World Health Organization itself is facing some funding constraints. So, how has this global shift influenced how WHO is rethinking its role and technical support in Nigeria, particularly in times of prioritization, partnerships, and sustainability?
Thank you. And I would say that this is not Nigeria only, but at all levels. So in the timing of pressure around the resources, obviously they result in some type of crisis, but they also drive strategic decisions. We have to prioritize in a different ways. We have to reset and to make sure that based on our strengths, based on our core comparative advantage, we can reshape the type of interventions and operations at all levels, at the global level, but also at the regional, and most importantly, at the country level. It means that we need to look at less priorities, being very selective on what we take forward, and making sure that our financial and human resources and technical capabilities are directed in those areas where we can make a difference, and difference being strengthening the national capabilities, national institutions, to deliver services. One of the major lessons I learned in my journey, going back to the first question, is really distinguishing between project thinking versus system thinking. And there is no way for WHO to really not making sure that we are on a sustainable pathway when we deliver our technical or financial decisions around our support. So whatever we do, we have to make sure that this assistance is sustainable, and we are strengthening national institutions, national capacities, national cadre to continue the interventions for which we, as a transition, we provide this support. And WHO has a very clear mandate on bringing evidence, convening partners, and making sure that the support which comes from WHO through evidence-based approaches is integrated into programmatic solutions which the country puts forward to address the burden of diseases in the country, and also strengthening the foundation, which is the health system. So by doing so, we can accelerate better health outcomes, but in a manner that really builds up the foundation for universal health coverage. And these are local institutions. And that type of engagement drove us into looking into our own ways of working. Is not for us to do more with less, but to really engage strategically and always take the system thinking and sustainability as a part and parcel of our interventions. So this is very important in my view, that the crisis also provides the opportunity really to rethink on the way we are engaging with the government, with the local authorities, and with the partners, and supporting the government in their own ambition to allocate resources domestically and to sustain the service delivery and the policy processes with proper accountability and making better decisions with better data.
Interesting. I mean, strengthening the research capacities that are already, existing, and making sure that there is a clear sustainability plan so that, you're building more and more resilience just by doing that. And thank you for bringing me back to, the experiences that you have, and understanding this kind of context and how to, I'd like to unpack it some more, is there something that we're getting right currently? And just to see how it's been 4 months since you resumed in Nigeria. So are we getting something right, and are we on sound footing to, based on your experience, to inch closer towards
No, absolutely. And I think I've been quite impressed by how, in such a complex environment, the foundation of the sustainable pathway is being very quickly, I would say, streamlined in the work of the federal government, states, and how the partnerships and trust between partners is being harnessed in the dialogue, which we have a number of opportunities to reflect on that. But the actual sector-wide approach which has been launched is basically a pathway to achieve the sustainability and domestic funding through that transition, because we are facing a transition. We mentioned about reducing the funding, the international funding for health, which affects everyone. It affects the government, it affects the partners. But I think that the platform and the dialogue and the design of the dialogue and the tracking elements brings a lot of accountability into what government and what partners are taking forward. And that feedback mechanism, which is established based on a clear accountability, in fact, mutual accountability, brings us closer to focus on outcomes, right? We sit together, we analyze where the needs are, we support the leadership role of the government, which is front role in driving the agenda. And then we see where are the gaps and where are the needs. So we focus on the demand-driven model in providing technical assistance, but with the view on sustainable pathway. Always do that, and progressively we are encouraged to do that with the strong national leadership in the ways that we are having one plan, one discussion, right, and one budget. And we question that. When we question the way how we can improve each time, I think it's been already a journey of a few years in that model. And I think by now I personally see a lot of benefits, a lot of positive outcomes of the process. So now also we want to see a stronger positive outcomes in terms of the key indicators, because we're still struggling, I think, and everyone is noticing that the baseline has been very challenging, with a lot of problems across the board in terms of the communicable diseases, vaccine preventable diseases, but also the key strengths or key foundation of the health systems. All of them, they've been benefiting from investments, domestic investment, also international investments. Now, the challenge is also to translate that into commensurate results. So I think we are prepared to face that challenge altogether and to exercise our accountability of what we bring to the table.
Right. Great that we've mentioned the issue of accountability, because really, if we're building something and there's clear parts and all the pathways are in the right place, then accountability is going to ensure that we get where we're supposed to be going. So let me just segue into what is going on globally, and I'd frame it this way to say that global health leadership is often exercised under intense pressure, both political, financial, and human. So, what has sustained your optimism and commitment over the years? And when you look ahead, what kind of impact or legacy would you hope WHO's work under your leadership leaves on Nigeria's health system?
I think there are a couple of questions. So let's start with optimism. I'm really, I would say, optimist particularly when what inspires me is to see that, particularly when you go to the field, you see the commitment of the frontline workers. So very often under very, very difficult conditions, but they go to line of service every day. They help people. They find solutions even in resource limited settings. And I've learned that in not only in Nigeria, where I see and I'm impressed. I've seen that in other settings when with very limited resources, the health workers, communities, they really find solutions and they never give up on health. So even with little services around, health services and health workers very often overstretched. They deliver service. They feel that this is something which is absolutely irreplaceable. Second, I think that I'm particularly optimistic and inspired by seeing younger people. And I've learned something very, very exciting in Turkey first with the community monitor, which was an innovation from the ministry. But here in Nigeria, I've seen the very excellent network of fellows. So the health fellowship program, which are young people who are contributing to developments in the places where they work. They bring new ideas, they learned, but they also learn in the way that improves every day the outcomes. And I think that thinking that this young generation will take forward the excellent ideas, excellent innovations which are happening right now is a source of optimism. I'm optimistic also when I look at the community strengths itself, because I think communities, they have a lot of assets. We are used to look at the gaps, what is not available, and we are less kind of, I would say, observant around what strengths solutions are there in the community. And usually there are strengths. There is a community leadership. There is a sense of support which is happening at the level of community. And I've been impressed even during the, let me take the example from other countries. In Turkey during the Syrian refugee crisis, I've been impressed by the communities which had very little in terms of the resources. They shared, they opened their doors and their hearts to the refugees only because they felt that this is the right way to share the bread and to share the shelter, their places where they live with people who are vulnerable. And then the same happens at large in Nigeria from what I've seen. So the community always would have the strengths. We have to map those strengths and to build around those strengths rather than to emphasize the gaps. And community is always ready to co-create solutions. So it's not the top-down solution creation. It's co-creation of the solution with the community. And this is how the trust is then established between the community and the providers. But I'm quite optimistic when I see that discussion on ownership and domestically owned systems and accountability. I think that this is really very obvious that there is no other solutions, and I see people are embracing the idea, and no one is there to solve the problems in a sustainable manner except people who show leadership, who knows that their family, that their community are there, and they do their best to find those solutions. So this optimism comes from many sources, and I think is the scope of leadership, people, communities to embrace that vision and every day to do something more and something different in the addressing the health needs in a sustainable manner.
Absolutely. I think the points you've shared really are the pathway to rebuilding trust in the systems, because once the community feels heard and they are also part of the co-creation, they now say, yes, we need to be part of this and protect it and own it and also make sure it works for us. So before I let you go, still one more question. You've shared your optimism, you've shared your commitment, so I'd like just to share with us also what we can look forward to, because it's an election year coming up, 2027. So there's a lot of, concerns around what's going to shift, what's going to, but of course, as a guide and, as a partner that is not in any way affected by this, what should keep us grounded at this very particular, moment?
I think these institutional capacity, because the health outcomes, they never change overnight. You have to invest for a significant duration to get the public health outcomes. At the same time, public health achievements or wins are never permanent. You have to defend them all the time. So from that perspective, and going back to the question which you asked earlier about the what would I like to see happen over the years, so beyond the election cycle, I definitely want to see improved health outcomes. There are a number of very, very strong transformational reforms going on right now. They have to pay off in terms of addressing the issue of polio and low immunization rates we are facing right now, and we are struggling. There is a lot of progress, but also there is a lot to do to improve that. I personally want to see how the incidence of TB, tuberculosis, or the burden of malaria is decreased, and we can document that by better actions and better quality of the data. I want to see better health outcomes on maternal and child health, because we are struggling. I see we are continuing struggling with that, but also that will not happen without the foundational changes at the health system level. That's why the human resources part, the health system financing and domestic funding, but also accountability for allocating resources and accountability for tracking the utilization of services is very important. These are the levers through which the country can sustain the positive trends and accelerate changes, because what we are looking for is not just like the incremental improvement. I think in many areas we need accelerated change. So this is my expectation. This is where me, as leading the operation in Nigeria, this is where I look to contribute with our very concrete support to the national process, to strengthen the institutions, to make sure that those changes are driving lasting impact. So, as you mentioned, there might be changes in the system. I think those foundational elements which already have changed, because there is a trend in allocating more resources for health. There is more intelligence around national health accounts through traceability of those resources and tracking how those resources are reaching the service delivery, how they're reaching the community. We have more evidence with health labor market analysis when it comes to human resources, which is a big challenge. The health services are not around the buildings. It's about strong primary health care as a pathway to UHC, and also anticipation, because primary health care is not only the service which people are coming when they need. It has a very strong role in bringing the public health capabilities and also preventive measures. And you can do that only when you also have data, because data can help primary healthcare services to really reach those in need and to anticipate. For example, I'm giving you an example. When we know through the surveillance, when we pick certain risks and we know which groups may suffer, the opportunity to do the anticipatory measures, or we know the low immunization rates in particular groups, we can do much better job in reaching them. And this is in fact at the core of the current efforts around immunization and addressing the vaccine-derived polio outbreak. This is what I think should and will happen with the proper sustained effort. I think there are a lot of positive developments which we all support. And this is not only about the national federal level. This is very important and transformational and catalytic when it comes to a system change from the federal level. But a lot has to happen at the state level and at the local government area when it comes to enabling the services and ensuring that people can access services without financial hardship. So this is the key essence of universal health coverage. This is how the country will basically, based on a very strong primary health care, which is trusted, which integrates data, surveillance, public health function, and brings the services of high quality to the communities which trust and which can co-create solutions.
Thank you so much, Dr. Ursu. This has been a very enlightening session for me, and to understand just how privileged we are to have you right now with us in the country and helping us, shape the next phase of progress in our health
Thanks
space.
for having me. It was a pleasure.
Thank you.
Thank you.